This morning we had a very interesting presentation. It had to do with the use of Canagliflozin, which is a new class of drug. It's an SGLT2 inhibitor, and what's novel about it is that this study was in patients with type 1 diabetes. It's currently on the market and it's approved for patients with type 2 diabetes. However, in this trial of 350 people with type 1 diabetes, we demonstrated that it is of benefit in terms of decreasing the postprandial glycemic variability. Patients were on CGM, which is a continuous glucose monitor, and it demonstrated much lower excursions. Patients felt better and the results looked very good. There was a modest reduction in the hemoglobin A1C levels, but patients actually needed less insulin, and overall they fared well. There was a very small increased incidence of DKA in those patients with type 1 diabetes, but at this point we figured out how we can minimize or we can prevent the development of diabetic ketoacidosis. One of the many challenges of the treatment of patients with type 1 diabetes is the glycemic variability. The blood glucose levels fluctuate. It really depends a lot on what they eat, the physical activity, more so than people with type 2 diabetes in general, because there is a great deal of fluctuation and they don't have any endogenous insulin secretion. So anything that can help to decrease the postprandial glycemic variability is of benefit. Currently, it's not available for patients with type 1 diabetes because it's not approved by the FDA yet. Our hope is that with studies like the one we presented today, as well as with several other studies, the FDA will consider approving it for patients with type 1 diabetes. Hopefully, a lot of the patients with type 1 diabetes will be able to benefit from that. We never talk about for all because some people it works, for other people it does not work, but it's certainly a nice option to have as an added medication to the armamentarium and to what we can offer to our patients with type 1 diabetes. Hopefully there will be additional studies because currently there are 3 SGLT2 inhibitors on the market, and if the other studies prove it as well as our study has shown the benefits in people with type 1 diabetes, we expect the FDA to look at the data, consider it, and hopefully at some point in the not too distant future approve it so we can offer it to our patients in the clinics. Well, we certainly can educate our patients, and it's a message of hope as well, that there are new things on the horizon, new medications, new forms of treatment, and that there is so much we can offer to our patients with diabetes, both type 1 and type 2, and showing the benefits of the new classes of drugs that are coming out, and educating the medical profession on how to best use those new classes of drugs.